So when you're going to the doctor, it's very important that you think about a little ahead of time, make a list of some of the questions that you have that you're going to want to bring up. It's important to have an advocate with you sometimes, a friend or a relative that's willing to go with you and make sure that you get your questions asked and maybe write down some of those things or help you remember later what it is exactly that they said. I know I go to the doctor and they got you in and out of there so fast, it's like, you don't, what happened, you know? And so to have some advocate with you that can kind of help you remember what it was that they told you can be really, really helpful. Also remember that everything that you're taking counts. When you're going to the doctor and you're going to ask questions or you're going to try to figure out why you're not feeling well or something, everything that you're consuming counts. So remember not only your prescription medications, but like over-the-counter pain relievers or vitamins or eye drops or laxatives or anything that you might be taking, because it's, being a doctor is a little bit of investigation work and trying to figure out why somebody's having these issues or these side effects. And knowing everything that's going on can really be helpful. And also check with your doctors on how well things are working. Follow back up with them and what are the expectations? Do you still need to take it? We mentioned that before. If you start a medication, do I still need to be on it? I've been on it now for a while and I'm feeling better. Do I have to keep going? When does it stop? So that's an important thing that you ask. Also ask if there's other things that you can do. Good example always is drugs for lowering cholesterol. You go to the doctor and he says your cholesterol level's high and he puts you on some cholesterol lowering medication. Is there anything that I can do? Can I change my fat intake? Can I maybe go down and do a little exercise or something and be able to be off of this medication? Things like that can affect your muscles and a bunch of other things. So if you're borderline, you might be able to get off of it. That's a good thing to ask if you can cut back if you don't need it. And I want to make sure that I let you all know that I'm not advocating that you stop any kind of a medication, only that you just ask the question of, do I still need to take this? Is there anything that I can do to lower the dose or maybe eventually be off of this medication? Would always be helpful for you. I'm a strong advocate of the less amount of medications that you take, the better, because it lowers the opportunities for problems. I think it's important that when you go to the doctor that you take a written medical history with you. So it's something that you're going to, kind of put together and take with you whenever you go, so you don't have to necessarily remember everything. If you can make a list of those things, what your conditions are, you're going to different doctors or something, so that you don't have to try to remember. Have that available to them.